Hello, I'm Dr. Sam Goldhaber, president of NATF, and today on Clot Chronicles, I'm going to discuss prevention of pulmonary embolism and prevention of DVT in patients who are diagnosed with cancer. Certain cancers secrete substances that increase the body's clotability, and therefore patients with these particular types of cancer, such as pancreatic or stomach cancer or certain types of lymphoma or brain tumors, are at very high risk of developing large pulmonary embolism or large DVT. Furthermore, when these PEs or DVTs do develop, they are more resistant to standard anticoagulation than for patients who do not have cancer. In addition, certain types of chemotherapy for cancer, for reasons we don't understand, also predispose to pulmonary embolism and to DVT. So an ounce of prevention is worth a pound of cure, but until recently we haven't had any strong scientific evidence that prophylactic anticoagulation can reduce PE and DVT safely in patients with cancer or patients who have cancer and are receiving particular types of cancer chemotherapy. Recently, in the New England Journal of Medicine, 2 back-to-back trials were published about preventing pulmonary embolism and DVT in cancer patients, and these trials randomized the patients either to real rivaroxaban versus placebo or to real apixaban versus placebo, and they found in each of the 2 studies that the direct oral anticoagulant rivaroxaban in one study and apixaban in the other study had a marked reduction in the development of pulmonary embolism or DVT. Now, they are anticoagulants, and we have to keep in mind the bleeding complication rate. The major bleeding complication rate in each of the 2 studies was about 1%. Looking at the benefits versus the risk in each of these 2 studies, there was far more benefit than risk in being prescribed the rivaroxaban or the apixaban than risk. Now, this doesn't hold for all cancers, but only for cancers with a particular predilection to causing pulmonary embolism or DVT, and only for certain types of cancer chemotherapy. So the bottom line is that if you have cancer or you have a relative or friend with cancer, you should encourage that individual to speak to the healthcare team, to the doctors and the others involved in the cancer care, to discuss whether it's appropriate to prescribe one of these direct oral anticoagulants to reduce the risk of developing pulmonary embolism and DVT. This is Dr. Sam Goldhaber signing off for Clot Chronicles.